All right, hello everybody. So today we are going to have our Q&A session with Professor Anita Hubley. I want to have an introduction. I want to introduce Professor Hubley a little bit. One second. So yeah, well, let's introduce Professor Hubley first, and then we can start with the session and start to respond to the questions. So Professor Hubley, she earned her PhD in psychology with a specialization in human assessment from Carleton University. And she also has a master's degree in psychology with a specialization in lifespan development and aging from University of Victoria. Dr. Hubley is a full professor in the Department of Educational and Counseling Psychology and Special Education, ECPS, at the University of British Columbia. Where she is actually a member of the Measurement Education and Research Methodology and Counseling Psychology programs. She's also director of the Adult Development and Psychometric Lab. She has been conducting research with adults of various ages in the community for over 30 years. Give me 1 second. Sorry. So yeah, she is associate director of the journal Measurement Instrument for Social Sciences, and she has served on the editorial board of Social Indicators Research and Encyclopedia of Quality of Life Research, first and second editions. And she also has participated in the Journal of Psychoeducational Assessment, the Canadian Journal of School Psychology, and Canadian Psychology. She's a former member of the Executive Council of the International Test Commission and former editor of their publications in the Journal Testing International. She has published more than 100 academic articles and book chapters on topics such as reliability, validity, assessment in health and psychology, development and validation of measures of quality of life, depression, memory, and subjective age, neuropsychological assessment, quality of life in vulnerable populations, among others. Professor Hubley also has developed several clinical, health, and psychological tests, including the memory test for older adults, MTOA, Modified Taylor Complex Figure, MTCF, and quality of life in homeless and hard-to-house individuals, QOLHHI, to name just a few of her measures. So yeah, thank you very much, Professor Hubley, for accepting to participate today. We are a study group coming from NCME, so most of our expertise is very related to educational measurement. And we don't know really much about psychological testing, or we have like a very scarce idea of it. So I think this chapter in particular was particularly challenging for us as a group. And you have like the exact profile we needed, because you are very good into psychological testing, but also you understand educational testing. So you have that bridge that will help us today a lot, I think. So thank you very much.
Sergio, thank you for that introduction. You made me realize how much my world is comprised of acronyms. So it's kind of interesting to hear. Yeah, and I thought it was really interesting. I listened to the discussion that you folks had, and then also got the questions. And it was fascinating to me, coming from a psychological background, but having worked in an education faculty for more than 22 years now, it made me realize even more what the lack of a bridge there is between the different forms of testing and some of the information. And I've thought about it a lot from what the psychological assessment, what isn't there in terms of some of the measurement that you get in education, but it also made me realize what is also missing in terms of educational measurement, understanding the psychological context as well. So that was really interesting. So what I did is I took the questions, the 8 questions that were posed, and I numbered them so I could kind of reference them again. But I actually would prefer for us not to go through them in the order in which they're presented, which I know was partly reflecting the number of sort of likes people had, but really to maybe ground this first in a discussion around these differences between psychological and educational testing, and a few comments about psychological assessment, because I think that really seems to be the heart of where some of the confusion or the difficulty in grappling with the chapter was. So before I make some comments, I'd like to hear what some of you see as potentially the differences between psychological and educational testing, because it didn't really come out in the discussion that you had, but I'm curious where you all are with that.
Very interesting question.
Yeah, anyone want to jump in with how you think that they might be different? This isn't really about whether you're right or wrong, it's more just your perception.
Yep. Please feel free to jump in and respond this.
I know it's a lot to think about, but you got a sense in the chapter that the chapter seemed quite different from some of the other ones. And of course, part of that was you had transitioned into the context and setting of testing rather than some of the general principles that apply across the board.
I'm just like thinking out loud here.
Mm-hmm.
So two things come to mind. One is that there are similarities, right? So you want to do psychological assessment. In a way, you are looking to measure social emotional skills like in students and develop them. And the second thing is the difference between diagnosis and assessment. So in education, it's more about assessment, or you're trying to, develop some ability or skill within the students, but in psychological assessment, it's more about diagnosis. So maybe the measurement models are different. And something else came to mind. Yeah, I think that's it for now.
Okay.
It's very high level.
No, it's a good place to start. Anyone have any psychology background in terms of a degree or coursework? Okay. So Maggie, a little bit.
I started off in educational psychology and then switched to social research methodology.
Okay. Well, oh, go ahead.
I'm studying work psychology, and I have like very brief background, like a few undergrad courses in psychology, but nothing major.
Okay. Well, Lisa tells me kind of a little bit about the background. I think one of the things that is notable, especially the way I know you haven't quite, I don't know whether your group has quite gotten to the discussion yet on the educational testing chapter, but it's quite confined the way, so they've basically not discussed classroom tests, because that's always problematic when we start talking about what you can realistically do with classroom tests. But they've really focused in on tests in the educational context that are about monitoring students, about tests used in college admissions, English language proficiency, alternate assessments for individuals with disabilities, but it's really kind of confined. In the psychological testing and assessment chapter, it is, I think, one of the reasons why they kind of list that whole gamut of tests is to give people a sense of the incredibly wide range of areas of testing within psychology. And it's interesting, there are things that I think from a psychology standpoint, one might think of as educational testing really still falls under psychological testing. So any of the stuff around learning disability assessments is coming under psychological testing and assessment rather than educational, even though it's within an educational context. So it is quite a broad area, and I think that's part of the issue. I think what was already mentioned about sort of diagnosis coming in, that's a piece of psychological testing. It's a large piece, but it's not the only piece, because we would still consider certain aspects of psychological testing within even a research context. So it wouldn't necessarily have to be diagnosis. It could be just screening that you're doing. So it's quite broad. And so that kind of leads me to the next piece, which is about the testing versus assessment. I thought it was interesting in the standards in the educational chapter, they comment specifically on how the two can differ, but they often use them interchangeably. But that's not the case in psychology at all. So while it's true, some people might, in a very informal sense, use the terms interchangeably. There really is, if you're an assessment specialist, then that's a big difference between testing and assessment. So assessment really is that much broader process of integrating information from a variety of sources. And interestingly, assessment doesn't even have to include testing. So you can do an assessment with no testing at all. So you can base that on your interview with the person, looking at their history and file information you might have from medical records, from other institutional records that might exist. So jail records, for example, if that was applicable, legal records, if there were, let's say, custody issues involved. You'd also include potentially, potentially you're going to include information from other sources. So that could be teachers or parents or siblings, friends, other family members. So there's a variety of sources. Could be doctor information, if that was somehow relevant. And then a big piece is also observation. So the minute, if I were doing an assessment, the minute a person walks, well, not even before they walk in the door, I'm already doing observation. I'm already looking at their attention to hygiene, to give me some context in which the person is taking care of themselves and the context in which they're living. I'm looking at their level of nervousness. I'm looking at sort of their behavioral stuff. So all of that plays a role. That has become, just a little aside on that, that's become a big piece in terms of cultural awareness as well, because some of the things that we were initially taught to look for, like eye contact, there are cultural components to that you need to take into account. So there's a lot that you're taking into account when it comes to an assessment. And then the use of tests in the context of the standards, that's what we're interested in. But the use of tests is just a piece of a larger puzzle that you're putting together. So when someone comes for an assessment, you start with your referral question. So I wrote down just a couple of examples of referral questions that you could get. And they're often pretty simple, simple in the sense that the referral question itself tends to be relatively short. So it could be, does this child have a learning disability? Or what is the likelihood that this person would reoffend if released into the community? This person suffered a concussion as a result of a car accident 6 months ago. Is their reported memory loss real? And is this older adult experiencing depression, anxiety, and/or memory loss? So I wanted to give a couple of different kinds of referral questions there so you could get a sense of, are you trying to distinguish between possible disorders like depression, anxiety, and let's say dementia? Are you trying to predict someone's behavior based on the information, past information, and what you can test? Are you administering a variety of tests to determine A, let's say in the case of the learning disability, A, is there a learning disability? And if so, what exactly is that learning disability? And what would further happen is if you thought there was a learning disability, what is the extent of that, and what might, you might do some more non-standard testing where you want to find out, okay, if I remove time limits, does that change what the person can do? Just so you can help inform what accommodations might be appropriate for that person. No point in giving someone time extensions if that makes no difference whatsoever. So that referral question becomes a big piece. What I found in listening to the discussion that you had was it seemed like there was a bit of, I don't know if confusion is the right word, but there's sort of, okay, here's the argument that you make in terms of validity with respect to a test and the score from a test, the inference that you're making about this test score. And then there's the additional piece in an assessment, which is what is the argument or the logic or the, let's see the word that I wanted to use, because I do think that you had a question about this, what was it here? Logical analysis rather than argument. And I think argument sort of harkens back to Keynes' validity, argument-based validity approach or framework. And I think a variety of terms could have been used besides logical analysis, except that I think they mean something a little less formal than perhaps Keynes' process for validation. Here they're really saying, if you're going to answer this question, provide a logical analysis, a logical argument, a rationale for why you've approached it this way, why you chose these tests, why you didn't use other tests, to at least be able to, you don't make that argument in your report, but you should be prepared to provide that justification. So I think, kind of going back to that one question, I think that was a distinction. You always need to be aware of the validity evidence for the test that you use, or the fact that it may not be there. And then you have to make a rationale for why you chose to include what you did in order to do the assessment to answer this specific referral question. So I have some other things that I can say about that, but let's kind of stop there and see if there's any sort of follow-up or questions you have kind of connected to that, or comments. Does that help frame things a little bit better for the chapter?
Yeah, absolutely. Yeah, at least the difference between testing and assessment. Yeah, I can see that in educational testing, usually there is an assessment, and kind of like everything comes together. But in psychological testing, you can see like the difference much more clear. In educational testing, there is also a difference for sure, but sometimes that is more confounded maybe. Or, so yeah, and yeah, and sorry, I put the link to some Envision board for the rest of the people to see the questions again, because I'm not sure if everybody has the list of the questions. But yeah, there was one question that spoke about, let me see. There is in one part of the chapter, it is used the term logical analysis rather than argument. And that was one of the questions, just to put in context for the rest of the people. Yeah, I think we have talked a lot about validity along, like during the different sessions of the standard. We started with the validity chapter, so it kind of like sets the tone a lot also. And yeah, at least when you ask at the beginning, like what are the difference between educational testing and psychological testing, sometimes I have the feeling that that separation is actually kind of projected maybe a little bit in the term interpretation and use, in the sense that psychological testing most of the time is more about interpretation. It's not working necessarily with the use. It will be necessary depending on the context, but I think the concern about interpretation comes more on the can be traced to the history of psychological testing. But in the use, I think can be traced more on educational testing, because in educational testing is when you actually have a much more broad and consequential decision. In psychological testing, it is very consequential, but not necessarily broad, in the sense that you are kind of doing like a societal decision, like for example in college admission, that you're literally like separating groups of people like in bulk. psychological testing also can have like a big impact, of course, but I don't think it's that intention. So it is intention in that way. Maybe, I don't know. But yeah, I think
it is interesting the way they are presented is, it's so funny. It's so different from how it's taught in our program, but excuse me, but it does seem to be the separation between sort of decisions that affect groups rather than, although this is not really the case for college admission, but in psychological assessment, there's a lot more emphasis on the individual and making decisions that impact individuals. So in terms of accessing supports or accommodations, or whether they're diagnosed and can get treated for things, or are categorized into groups. So yeah, that's an interesting distinction. And also your comment too, we do spend a lot of time, and certainly, you go back to Cronbach and Neal's work and so on around constructs. We spend, there needs to be greater attention, at least in the psychological field, around construct conceptualization, operationalization. So I spend a lot of time with my students talking about that. Do you really know, just because a test is labeled as a measure of, say, depression, is it really a measure of depression? And do you really, when it comes to validation work, you need to know what your construct is in order to know what to use, say, in convergent and discriminant evidence. You need to know what other constructs you should be considering. And I don't think we necessarily pay enough attention to that. I think when people, are looking for tests, they focus on what the test is labeled, and they focus less thought on even just reflecting about whether it's actually getting at that construct. So there's a lot of overlap in symptomatology between depression and anxiety. Are you really assessing depression, or are you assessing anxiety, or are you simply assessing psychological distress? So what is it that you've actually got? And I've seen some measures. So I can think of one measure of depression and anxiety. So it has two subscales, and certain evidence, the way it's presented, is very supportive of, oh yes, the depression subscale is measuring depression, the anxiety subscale is measuring anxiety. But we actually did some other analyses that showed, for example, that that there were higher relationships between the depression, say the depression subscale, and another anxiety measure than another depression measure. Like it was odd that you had some evidence that supported the constructs that were presented, and you had other evidence that actually raised questions about how distinct these two subscales really were. And we just don't pay enough attention to that. So if you're going to make a decision about whether someone has anxiety versus depression, and that impacts in some way your treatment protocol, you want to get that right.
Yeah.
Especially because depression, certain treatments, if you're talking about a medication or a drug treatment, it can take quite a while to find the right drug treatment to treat a specific depression. Do you really want to spend 6 months or a year trying to get the medication right, only to discover you have the wrong construct, the wrong condition? But it's sort of the other thing I want to touch on. I can't remember who said this in the discussion around how I don't know whether it was you, Sergio, or someone else, but someone commented that they thought that the chapter should open with "read the test manual," which made me laugh out loud, because it's so true. That really, that ought to be one of the first things that gets mentioned, is to read the test manual. This is a little bit of a distinction between psychology and education, though, because I would say that there's an awful lot of tests, good tests, that are not published by testing companies and do not have test manuals. So you're quite right that people need to read the test manual, because lots of people purchase tests and figure out how to administer it, take a look at how to score it, maybe look at sort of some of the interpretation piece of it, but actually don't look at a whole bunch of other information or even make assumptions about the administration and scoring. So lots of mistakes get made. Lots of people don't look properly at norms. I can't tell you the number of people who give a test in a clinical situation in which they're getting paid to administer that test, only to discover afterwards that they don't actually have norms. So either what's presented in the manual are not actually test norms, so they might get means and standard deviations, which are not norms. And so they, just because it got, and there's lots of articles out there that say, oh, here's norms for the such and such test. And when you look, there are no percentiles or standard scores or anything resembling a norm. And they don't look in advance. So then suddenly they're left with test results they can't do much with. Or they discover that they didn't look closely enough to see if their client or patient is represented by those norms. So they test someone who's 83 years old and discover that the norms ended at 65. So the reading the test manual, I think, is a really important thing. And then the other piece is so much of what we use may only be in journal articles and not in any compiled form, may not be in a book or a test manual. And that's not to suggest these aren't good tests. A lot of that is a practical component of the setting in which things are used. So when I did an internship in a hospital, in a neuropsych unit in a hospital, when we needed a test, we went to the test company's catalogs and we looked for, oh, I need a test of executive functioning. What's out there? If you're in research, if you're in private practice, where time is money and tests cost money and so on, people are looking for something that is freely available. If you're a not-for-profit, you don't have money to spend on tests, even though you might be wanting to assess things to be able to apply for grants and show things. So the lack of published tests from a testing company doesn't suggest anything about quality. It does make it harder to find the information you need. Yeah.
We can take some time for reactions to this or any other comment.
I do have one comment. I think in education, though, we do have some uses that are similar, though. Like, for example, for my job, besides my doctoral work, I work at CREST at UCLA, and we have a group that works on the Alpha 21 EL assessment. So obviously testing students in and then testing students out is more focused on the individual rather than on groups.
Yes, absolutely. Yeah, I think what I mean more is that in psychological assessment, I think we do far less group work than from an assessment standpoint.
Yeah, but I do know also that the states and the districts sometimes take into account other information that the tests don't reveal. So like, because the cut point to, in some ways you have one child 1 point above and 1 point below, like where does that child really belong?
Absolutely. And that's really critical to be able to look carefully at what's going on around the cut point and how much error might be around those cut points. Yeah, I think, I don't know in psychological assessment if we pay as close attention to that, but then partly you're also looking at a compiled set of tests rather than trying to use a single test. We're not focused as much on a single test in an assessment. So you are trying to integrate across those, and you may end up having to administer another test to try to get a better picture of what's happening. When you get something like what you're talking about, someone's very close to a decision point. Yeah. One thing that struck me about chapter 10 as well is how much, and this may reflect some of the struggle that some of you had with this chapter and how it differs from some of the other chapters. A lot of chapter 10 is about good judgment. It's really about good judgment in terms of the test user qualifications, in terms of your selection of tests, in terms of the arguments you put forward. So as an example, I thought it would be interesting to talk about the test user qualifications, because you're really talking about the boundaries around your own competence. So I thought about this, and it kind of goes back to this idea of just how expansive the psychological assessment field is. So I'll use myself as an example. I took a doctoral personality assessment course years and years ago, and we spent a lot of time in that course administering, scoring, and interpreting 20 Rorschach inkblot tests. So in addition to taking stuff on the NEO, which is a sort of a normal personality inventory, and on the MMPI, which is measuring more psychopathology, we also did projective tests. So, you know, doing work, actually looking at the results and interpreting results from 20 Rorschachs is actually a pretty impressive number for a grad course. But that's nowhere near enough experience with the Rorschach test for me to then go and use it in an assessment. So even though I could tick off a box that said, oh yes, I have doctoral level training in projective testing, and specifically the Rorschach, and you know, Exner's very precise system of scoring, I would not feel comfortable declaring that as an area of competence in assessment, in doing assessments. And likewise, I specialized in human assessment and did a lot of work in intelligence testing, personality testing, and neuropsych testing. That was kind of the areas. But I really am not an expert and really have no business without further training doing work in vocational assessment, right? Any kind of career assessment, work assessment, not really I can't do forensic. I mean, I've done some forensic assessments in terms of mental health, but generally speaking, in terms of predicting recidivism, I don't have any training in that area. So there's a whole bunch of areas of assessment that I would not declare as an area, and that's where that judgment comes in. As you heard, I have a master's degree, graduate training in lifespan development. So I've taken courses in child development and child neuropsych. I've taken courses in adolescence, taken courses in adult development, but my area of focus was adults and older adults. So again, despite all of the work I've done in neuropsych, I would not do child neuropsych assessments because I really don't have enough competence in that area. So that's kind of what we mean by this good judgment piece. And even though, again, it talks about courses, yeah, I could check off graduate courses in all those areas, but that doesn't mean I have any business going out there and doing assessments. So that's sort of that good judgment piece. And you can see how, while I can check off boxes, the standards are really hinting at a more nuanced appreciation for your judgment in each of these areas.
Yeah. Sorry, Moishira made a question in the chat. Let me do a comment before we continue responding questions. I mean, at least from my experience reading and discussing the chapter, it was very surprising for me, also considering that I don't know much about psychological testing, that many of the things that were mentioned in that chapter, for me, made total sense to copy that in educational testing and assessment. And actually, I was surprised that why this is not everywhere else. Like, and because even if we accept that eventually there is a difference in terms of psychological and educational testing, still all the concerns and all the recommendations that are appearing in that chapter make total sense for me in terms of when you use that in education. So, for example, the fact that you may require competence in the person that is interpreting a score. Absolutely. the fact that you need to do a more nuanced assessment that can consider different sources of information and not just one score, of course. And actually that is not just, that's actually something that happens. I mean, for college admission, for example, the College Board started to do this kind of like card that has a lot of like side information about the context and stuff that was considered like an innovation. But then when I read it, it's like, well, I mean, maybe it's not that innovative after all. I mean, in psychological testing, people are needing to do that. And there are good reasons actually for why you need to do that. So yeah, at least for me, I kind of I like a lot actually the chapter in the sense that it opened my mind to see that sometimes some of the concerns that you can see in educational testing actually are concerns that has been solved in psychological testing for a long time ago. and for some weird reason, I would say that it's more cultural than anything. Psychological testing worries more about certain aspects compared with educational testing that is more worried about creating this kind of products more than practices. That hopefully they can kind of like give you magical information to resolve problems, but that's tricky, and sometimes you can, sometimes you cannot, and yeah, so, sorry to come back again to educational testing, but it's kind of inevitable for me to connect with educational testing and take advantage of all the knowledge that is in psychological testing that maybe we are not reading that much.
I completely agree with you on that. And I think part of it has to do with the training that we give and the fact that we actually, I think it's a disadvantage that psychology and the more clinical areas of psychology, which is where assessment is now, they've kept a lot of education people out of those courses. So there's so much protection around who can do these assessments that there's so much fear that, oh, if we let you into this course, then you will think suddenly that you can go out and administer these tests, which you have no business doing because you have no coursework in psychopathology and so on. I think that there's so much fear around that and it's, you know, there was a question about regulation and regulatory bodies, and that's kind of what psychology has been trying to do to regulate, is to keep people out. But it's unfortunate because it means a lack of shared interdisciplinary knowledge and experience. And I think psychology could benefit from some of what's happening in educational testing, and educational testing could benefit from some of what's happening in psychological assessment. And there needs to be more discussion. And graduate education is so much of where that needs to be happening. Because that's where people kind of leave. You graduate, and there are lots of people who never go beyond their graduate training. So they work in the field, but they don't take stats courses after they graduate. They don't take, you know, they may not take more professional development in testing or assessment or stats. And so they really, what you leave with in your graduate education is so much of what's important. Should we address the question that is in the chat?
How do you want to move forward? Do you want to respond and share a question now? Do you want to respond the rest of the questions? Whatever you prefer.
Well, I can say very quickly, because the question is, what is the position and or value of a psychological tool which is not standardized in psychological testing and assessment? And then it's, let me just go down here. What practices are recommended in psychological testing if we do not find a standardized test in a culture for personality attribute? Okay, so let's very quickly, in terms of a non-standardized test, I would say for a lot of assessments, you want to use a standardized test, period, because you need to be able to defend the decision that you make. And if the test has not been standardized and you don't administer it in a standardized fashion, you can't make use of the evidence that's out there. The minute you change the scoring or the administration from the standardized approach, then you lose the reference to the psychometric properties of that test. You can't be entirely sure that the inference you're making is the same. You certainly can't defend it in the same way. So you absolutely want to be using a standardized tool. That is different from whether it's been published by a testing company, of course, because standardized simply means that there is a recognized protocol for administration and scoring, and you follow that, whether there's time limits and so on. Now, there is such a thing as a non-standard score, which is the idea that you break from the standardized protocol. So the idea here is that you really should still be giving the standardized test, but you may choose to do some administration subsequent to that that breaks from it. So one example would be, I'm doing a learning disability assessment. I'm now going to give the test without the time limit. So I can't use the norms. I can't reference the psychometric properties, but what I am saying is, okay, this person didn't do well on the test. So there is some sort of impairment of functioning in this area. But if I remove the time limit, does that change anything for the person? So is time or pressure a component that we can try to provide an accommodation? So what you do in your report is you acknowledge that you're reporting a non-standard score, that you broke from the standardization. This is what you did. And this is what your suggestion is, like a hypothesis of what's going on. So you justify it in that way. But you still need to have that in order to show that they had impaired performance. You still need the standardized process. Now, the second question that is presented here about we don't have a standardized test in a culture, that is, I'm going to comment on that sort of more broadly, which is a big issue that I think also comes up in this chapter, is that the subtleties, a lot of the questions were about kind of wanting more specifics. The fact is that there's so many variations on scenarios that can occur in psychological testing across all these different kinds of types of testing that it's hard to summarize all of them in a single chapter. So yes, there are lots of cases where you may not have a test that's fully appropriate for a given culture, a given language group, a given age group, to accommodate a disability, etc. So you have to make some tough choices. The strict black and white view says, oh, well, if you don't have an appropriate test, you can't give it. But that doesn't help a person you've got a child in front of you who clearly is struggling in school and can't get an accommodation without an assessment. And to throw up your hands and say, well, we don't have any appropriate tests, that's really too bad. That's not a very satisfactory position to be in. So what the standards also are trying to allude to is, given some of these very tough scenarios, what you try to do the best you can, given the limitations that you're facing, and then you try to provide, again, that argument, that rationale, or that sort of logical analysis for why this was the best case scenario, with all the caveats in the world as to why this is not as cut and dried as when you have all these perfect norms or tests or standardized procedures. I know we're getting short on time, so let me kind of touch on a couple of these other issues. I think we've kind of covered the question about logical analysis, the differences between psychological and educational testing. I think you have a sense of why they've sketched out the chapter the way they have. There's some questions about, what's the best way to describe this? So, okay, there's two questions, the first and last question, that have to do with improper test use. And, could you create a regulatory body? Could you create a set of best practices? And I think, let me comment on the regulatory body. Man, that is a long-standing question in the field, because the question has always been, how do you enforce compliance, or how do you address violations of the standards? And this is where there's no easy answer to it. I think a lot of people have wanted something to exist. It partially exists through registration bodies. So if you're a member of the American Psychological Association or if you're a member of AERA. Yes, they can do certain things, particularly if you're registered. So if you're registered as a psychologist and you're administering tests, complaints can be made to that body and they will respond in some form. Sometimes in a very satisfactory fashion, sometimes people are not happy with how it's addressed. It could be that the person is given a warning. It could be that the person is, if things are very egregious or if there's continual problems, the person can be censured, basically have their license at risk. So you can also do that with state or provincial registration bodies. Again, to what degree it's seen as serious or not varies, because of course some of these bodies are dealing with other ethical violations that they may perceive to be more severe, right? So sexual interference with clients would be right up there, and maybe in comparison, not following all the test standards seems fairly minor by comparison. So that's not always been satisfactory. But if we created a body, sort of like, we have out there in the world, we have the International Test Commission. Well, yes, there are organizations that are members, and the ITC could do what? They could revoke their membership. Well, that seems a bit problematic because you want them to be members and learn stuff. So you don't really want to take that away. So your ability to actually do anything is limited. And that has been the problem with all of this. Regulatory bodies work really well for creating regulations and issuing regulations and providing guidelines, but have been far less successful at dealing with violations of those. So I think it's a long-standing issue. The best practices, I think, is a great idea. I think we absolutely can always benefit from case examples of how to deal with different situations. You could do a whole book or a whole set of books on what those might be. Just like if you take a course in ethics, there's the obvious ethical dilemmas that, they give people to do in class and it's like, yeah, this is a problem. Then there's the far more nuanced cases where there's no clear, correct solution, that there's a pro and a con, a loss, no matter what you choose to do. Those would be the most interesting cases, but they're also not black and white. It's really about good judgment again, and consulting with others and trying to show that you've thought through the problems as best as you could. So those are short answers to really big questions. The thing that I think we can do, there was a question about basically, there was the work-based question around test takers not always being aware of their rights or being aware of some of these issues, and administrators or individuals within companies in particular not being aware. I think that, and also trying to increase awareness of the standards generally. I think that we've done a number of things to try to improve this situation. A big thing that happened in recent years was making the standards freely available, right? So no longer charging people to purchase the standards, but to make the digital copies widely available, I think was a huge step forward in making that information, putting that information out there. I think you've got organizations like the International Test Commission, APA, AERA, NCME, and other organizations trying to promote the standards. You've got individuals like myself, Steve Cerisi, Bruno Zumbo, and others who reference the standards frequently in our work in our publications and discuss the standards and try to promote that information, including this as at least aspects of the standards in readings and courses. Because again, I think educating, having new generations of individuals out there in the workforce who are aware of the standards is critical. The problem is with how do you reach test takers more generally? It does help that we can put things on the internet and people can Google things, but still the standards are not particularly, even for students and even for researchers in the field, they're not the most exciting reading all the time. So how do you make that more palatable, I think is really important. And for companies, what's the incentive? You know, I certainly know from an ethics, having sat on an ethics board for a very long period of time, boy, students and faculty and universities worry about ethics, but boy, companies who are doing research that don't have an ethics board they have to report to, they're happy. So how do you incentivize that? I think would be a big key. So that was me trying to wrap up a bunch of questions really quickly, but are there other things that kind of jump out at you now that we can discuss or address? It's a lot to cover.
I remember when I think it was Laurie Shepard's chapter, Evaluating Validity, something like that. That was a reading in the validity class at UMass Amherst. And I think it's in that paper that she, at some point, she mentions FDA and how FDA works. And I always have been thinking, like, if we are going to have some regulatory structure, why? I mean, it would make sense for me that it would be similar to FDA, basically, because yeah, you can create a test and you can distribute that, but still, it's similar to distribute like a chemical or like a pill or something, in the sense that in the broad use of it, you can have impact, you can have situations, etc. So better to kind of anticipate that and also control when something is obviously wrong or can do harm. So that, yeah, I never have understood why, when we know that testing can be harmful, still we don't take that as serious as compared with I don't know, like a chemical or a biological thing. And actually, I think we talked about that in the discussion session, that the impact of a bad testing or bad assessment actually can impact the health. It's not just like consequences and decisions. It can actually impact the body of the person. I mean, if we misunderstood the person, or if we misinterpret the person, if we take a wrong decision with the person, actually, it can happen that you can affect their psyche or, I mean, I don't think we have, at least in educational testing, for example, what are the consequences of, I don't know, all these tests for accountability in what's the impact of that in the psychological health of a student and their development. I mean, if we can trace in a teenager that suicidal thoughts or even like actual suicide is happening in the context of too much testing, or eventually potentially related with one bad I don't know, like result that was like given right away without any protection of the psyche of the student, actually we can have like serious things. So yeah, I've never understood why we don't take that as serious as I don't know, like the health in a more physical aspect.
I think that I do think that there is concern about that. I think that it's hard to anticipate all of, and this has been the issue, not that test consequences is about test misuse. That's obviously been a misunderstanding in that field, but there has been a concern about test misuse out there in the field for some time. I think we do worry about those. We struggle with we struggle with the regulation piece. We struggle with having teeth to do something, but then so does the medical field, right? I mean, I think we need to remember that, yes, while people get very much vested in what happens in terms of surgeries, in terms of drug treatments and so on, we know that there's lots of cases where, I mean, surgeons who have practiced for years and they have not been able to get rid of that person, and they move from hospital to hospital, still wreaking havoc. And there's a regulatory body. There's an actual body that can take away that person's license. and yet there is a reluctance to do so. But there's also within that field and within the educational and psychological testing field, a greater push for education. The idea is more that, okay, so how do we correct that? Do we really want to come down on people because they didn't anticipate something or they misunderstood something? We've invested in those individuals in terms of their preparation, but did we miss the boat on preparing them appropriately for this? So we educate in the hope that they then become better at their area of expertise, not just remove them from that area. So I think it's a matter of emphasis. Are you there to punish people who don't see all the potential consequences or miss the boat on something? And there are egregious cases where maybe you should do that, but or do you put more emphasis on re-educating? And we all know that measurement is a field that there's so many areas in which people should be getting measurement training, and yet there's only a small select few that really get those courses. So, we've made huge advances in that area, but there's still a lot of people who could benefit from the kinds of things you've been reading about in this group. So I appreciate that you guys I appreciate you showing up for this, and I appreciate your interest in this chapter, despite the fact that it would be a stretch for some of you in sort of seeing its application in your own areas. But I think it's a really important piece. And I completely agree, Sergio. I think that there are lots of things that could cross a lot of these chapters. I think part of that is having different working groups within the standards who write these chapters, but not necessarily always time for them to sit and say, oh, should we have written a different chapter that crossed these areas?
Yeah. Thank you very much, Professor Hubley. This has been really, really good, really great. Yeah, well, we are going to talk later about the video, and yeah, I think we covered all the questions, so yeah, we're good.
Most of them, maybe not the technology one, which I'll very quickly say is there is a whole bunch more that should be written about technology assisted and computer-based testing, and so much has happened since 2014, including the pandemic and that impact on testing. So that's a whole other piece.
Yeah. All right. Thank you very much. Nice to see you all.
Thank you all.